This is where most of our patients hang out. So a typical day starts pretty early. Oftentimes get to the office early in the morning. Oftentimes we'll make rounds early in the morning. Hey! Make sure everyone from, who are inpatients are doing well. Doing pretty good. Get to see them early, make sure they're on the right road. A little sleepy. I decided on surgical oncology because these are the patients who need the highest focus of care, the most dedicated, at the worst time in their life. More than anything, that's really the opportunity to impact that person on a real personal level, not just surgical. The multidisciplinary cancer program is really, I think, what it means to take care of a cancer patient. We see patients together. We talk about patients with all the specialties present. So we're gonna go talk to John, who had a excision of a melanoma and a sentinel lymph node biopsy. Hey, John. I think dealing with patients with cancer gives you a real opportunity to try to be human yourself. It is an opportunity to sit with someone, to learn about what they're feeling, what they're going through. So John is doing well after his melanoma excision. He's healing up fine. We're going to send him over to some rehab to help with the range of motion in his arm. But we'll follow him up in about 3 months and see how he's doing. I anticipate he'll do well. This patient has melanoma on the ear, and we're going to excise it and we're going to reconstruct it with our plastic surgery colleagues. I think the biggest thing that technology has given us in surgical cancer care is increased ability to do things through minimally invasive approaches. Let's see, what do you want to think? Double stitch posterior, you think? Not all cancers can be addressed with minimally invasive approaches, but a lot of cancers now we realize we can operate and do things through smaller incisions, which means a quicker recovery for the patient, which also means faster return to the rest of their treatment course. Yeah, boom. All right, where are we going now? What keeps me going are the little wins throughout the day. All right, so now we're heading up to do some rounds. There's this one gentleman, young guy, 53 years old, initially presented to our clinic from north of us with pancreatic cancer. And we saw him through our multidisciplinary conference. And we decided the best way to address his pancreatic cancer was to start out with chemotherapy, followed by radiation, and then by surgery. When we got all said and done with the surgery and we took everything out and he did well, and the final pathology actually showed us there was no evidence of cancer in there. And that is not common, but it really gives us hope in what we're doing that we're going to see more wins like that. There's no such thing as turning it off. Oftentimes, at home, it's, you got to go take care of the kids, you got to do the family stuff, which is very important. And then oftentimes the computer comes back on about 10 o'clock. Spend another half hour, 45 minutes, making sure everything is the way it's supposed to be, and then get it back up in the morning and do it all over again.